You just short of breath, is that it?
I was walking earlier and I was a little short of breath. I went to walk upstairs.
Do you need a wheelchair? Okay, well, I'll get the nurse and I'll put this in and they'll be back to get you soon, okay? Hello, I'm Peyton and I'll be your nurse today. What brings you in today?
I'm having trouble breathing.
Okay, when did this start?
It started this morning. I was walking and then I was short of breath and then I went to walk upstairs and it felt like I was suffocating.
Okay, so can you tell me your name and your date of birth?
Angela Lippincott, May 21st.
Do you have any allergies?
Penicillin.
Okay, and are you on any current medications?
I'm on metformin. Something that starts with an H, and it's a big long word.
Okay.
And that's not, I've got another one, but I don't know what it's called either. There's some
Okay.
big words.
Okay, well, can you tell me a little bit about what you do day to day? Do you smoke at all?
I smoke cigarettes.
How often do you smoke?
It's about a pack a week.
Okay, so about a full pack each week? Okay. Can you tell me a little bit about your diet?
Well, yesterday I had a steak and
Okay.
some cereal. I ain't ate anything today.
Okay. Do you exercise at all?
Not very much.
Okay. And do you have any family history of anything you think I should know about?
I don't think so.
Okay. Well, we're going to go ahead and do a quick little assessment and see what we have going on, okay? Can you tell me about your history?
I have hypertension. I got heart failure, and I got type 2 diabetes.
Okay, and do you have any family history?
My dad had prostate cancer, and that's about it.
Okay, so right now we're gonna go ahead and I'm gonna do a quick little assessment on you and see what we have. And then we're gonna look for a chest x-ray and we'll go from there, okay? Okay, so I'm gonna listen to your heart and lung sounds. Okay, and then I'm gonna listen to your lungs.
Here a little bit.
And can you take a deep breath? Another deep breath. Okay, are you having any pain at all?
A little bit.
Okay, where's your pain at?
In my chest.
And can you tell me what it feels like?
It's just really tight.
Okay, so you got some chest tightness. Are you having any shortness of breath? Okay, and did it just start today? Okay, and then I'm gonna check some capillary refill. Have you noticed any swelling in your legs or arms or anything?
Not really.
Okay. Alright. And then I'm gonna check your pupil response, so if you could just look straight ahead. Okay, and then can you open your mouth for me? Alright, looks good. Alright, so then we're gonna go get your chest x-ray results and I'll be right back. Okay, so your chest x-ray did show that your lungs are a bit enlarged and we are seeing air pockets in your lungs. So we'll have to keep an eye on that, and then your vitals, your pulse is 87, your temp is 98.7, your respirations are 22, which is a bit elevated. It's a little higher than we want it to be. Your blood pressure is 148/77, so that's okay. And your oxygen saturation is 84%. So that is definitely lower than we want it to be. So we're gonna go ahead and start you on some oxygen to help you breathing, okay?
What do you want my oxygen to be at?
So we're gonna start it at 2 liters, and then we'll increase it from there if we need to. Okay, do you have any questions for me right now?
What are you gonna do to help me?
So we're gonna keep you on your oxygen and make sure that we get you at a good oxygen level, and we can increase that if we need to. And then we're also gonna put you on some new medications to help with your breathing.
Hello, can you tell me your name? Date of birth?
Angela Lippincott.
Okay.
On May 21st, 1963.
Okay, so we got some of your results back, and they told you earlier about how they found the airflow pockets of your lungs. So we're gonna start you on new medication. We do find out that you do have COPD, and more focused on that, you have chronic bronchitis. So what that is the airway, where your airway becomes obstructed from something. So that's why you have that mucousy cough and productive, and you have all that mucus coming out, and that's why you're short, very, very short of breath. And you also have pulmonary vasoconstriction with that, so that's why you feel that chest tightness going on. So we're gonna start you on some new medications, and we're gonna put you on albuterol, and that's a bronchodilator, so that's gonna help you with your bronchospasms, those episodes where you're just very short of breath and everything, and that should just prevent or relieve those spasms. I'm also gonna put you on atorvastatin, and that is to prevent your cardiovascular, your heart disease, your heart failure. And to improve that. And we're also gonna put you on a steroid, and it's called methylprednisolone, and you take that every day as well, and it manages your symptoms of your adrenal insufficiency. So it helps boost your immune system and fight that inflammation in your lungs. With your albuterol, you'll take that 3 times a day, every day. So it helps you with your it'll help decrease your work of breathing, excess work of breathing, that bad. Do you have any questions so far?
Are these expensive?
Well, with that, I can't tell you the exact cost, but I can definitely get your caseworker in, and she'll help you. When it comes to your pricing, we're gonna get your caseworker, and he or she will help you figure out pricing. If you need coupons, we'll help you get at a discounted prices. So we will make sure that you get all your medications, and so that won't be a problem for you. So I'm gonna help you hand this to you. We have different patient teaching and patient education that we would like for you to follow. Along with the follow-up, we want to stop your smoking. That's a big thing. We're gonna have to, I know you say you smoke a pack a day, so we wanna stop that, slow it down and stop. If you need help with that, we can also put you on a nicotine patch or whatever. Also, we want you to stop your alcohol drinking. That's not good for everything that's going on with you either. And we want you to start exercising, so you'll be more healthy. That'll drop you some weight, so that way you'll start breathing better.
Okay.
And then we want you to follow up in about 3 to 6 months, because we want to see if your COPD is getting better and improving and everything. And if you have any more exacerbations or flare-ups, make sure you come back and see us so we can help you and get you settled away. Any more questions?
I don't think so.
And I heard that you eat steaks and juicy cheeseburgers, so we want you to kind of fix your diet a little bit, and that will definitely help with your vessels and strengthen them.
I don't know if I can throw away my steak.
Well, how about we try limiting them first, and then we'll talk about slowly incorporating them here and there. We don't need to eat them every day. We'll need a low salt diet, no juicy burgers every single day, maybe once or twice a week, every 2 weeks, and then just slowly incorporate them. How's that?
I'll try.
Okay, that's all we ask for is for you to try. Okay?
Okay.
All right.